I'm Steve Leichter. I'm the senior endocrinologist in the Piedmont healthcare system. I've been here in Columbus 30 years. I always wanted to be an endocrinologist from the time I was 6 years old. And I read a child's biography of Louis Pasteur, and I thought that he was much cooler than a baseball player. So the next time I went to see my pediatrician, I asked him what kind of doctor I had to be like Pasteur. And he said, "Why do you want to be like Pasteur?" And I said, "Because I want to grow up to solve complicated medical problems." He said, "Oh, you need to be an endocrinologist." The man knew what he was talking about. Until 1982, we used insulin that was derived from beef and pork pancreas. When I had a patient, and he was on 400 units of insulin a day, and no matter how much insulin anybody gave him, they couldn't bring his blood sugars down. And so because of that, we gave him a shot of human insulin, replaced his regular insulin with human insulin, and 4 days later, on 40 units of insulin, his blood sugars were well controlled. The Plizumab, the brand name is Tzield. It is a breakthrough medicine in the history of medicine because it's the first drug that blocks the progression of an autoimmune disease. The much bigger story is how are we going to identify patients who will be candidates for the drug. The testing that you do is a blood test. It's just a blood test. What it is to identify 4 antibodies that we know attack the cells in the pancreas that make insulin. And if you find a patient who has mild abnormality of blood sugars and 2 positive antibodies, they're candidates for this drug. And as of now, in Columbus, Georgia, we will be the first healthcare system in the world that can order this panel as a one-step push. We were the only pediatric hospital unit for a long distance. Now we're going to have a whole brand new hospital that can serve a wide variety of needs for pediatric patients. We are the only endocrinology center, to my knowledge, in the Southeast United States that integrates both adult and pediatric endocrine care in the same organization. Once we had the Velez family involved, as soon as we realized that the FDA was going to license the drug for prevention, we tested Ella to see if she was a candidate, and the answer was yes. And what she will tell you is that the most impactful issue for her in getting this drug is, as a gymnast, if she had type 1 diabetes, it would make it much more complicated for her to be able to do her gymnastics and avoid low blood sugars and high blood sugars. This way, she's just living a normal life and doing her gymnastics. I think that as time goes on, there's going to be a greater differentiation in the eyes of the community of Eastern Alabama and Western Georgia about the level of service here. And I do think that the new Children's Hospital is going to impact on that view. I guess I'd like to be remembered as someone that was very dedicated to endocrinology. I'd like to be remembered as a happy person and someone that was very dedicated to my community.